My expertise is in oncology. I actually began working on ovarian cancer and then breast cancer. And in recent years, I've actually expanded my research into endometrial and lung cancer. And now I begin to put together the metabolic alterations that impact cancer research. How do obesity and other such metabolic alterations feed into driving malignant transformation? And so for me, my drive and passion really is to begin to understand at the molecular level the various factors that really drive a disease known as cancer. I think from a profile, this would enable us to begin to find the key targets which would lead into therapy in order to bring the much needed succor to cancer patients and the family members. From a patient's perspective, all they care and want to hear is a cure. They don't understand the dynamics of the disease. They just want to hear, it's gone. And so this keeps me up at night. How can we really help to bring succor to, real suffering good people? My test kit is called a cancer drug resistant test kit. And what it does is quite simple. It helps the management team, the cancer management team, to really detect the onset of the drug resistance at an early stage. The ability to actually pinpoint this transition from response to therapy into resistance is key, because we do know that drug resistance accounts for the bulk of cancer-related mortality. And so being able to really detect the early onset of resistance to a certain therapy would really guide doctors and the management team to make adequate changes in order to really try to stop or minimize the occurrence of resistance. And so my kit is currently under patent in the US, but the nature of the kit is such that it should be readily available across board, even in developing countries. And in fact, we're trying to move it a bit further to see if we can actually end up by making a home detection kit, which would empower, the cancer patients in the comfort of their own homes to really do some real basic initial testing before having to move on to some specialist center. And so, although it's still a new technology undergoing validation, but we see this technology as a huge game changer in the way we can detect resistance and start to, devise alternative treatments. Part of a major driver for me as well is trying to move the cancer research information, the knowledge acquired in the last 50 decades. How do we move this from the scientific academic domain into the public hub, where people need to know, people need to become more aware of cancer as a disease? I think such information would help people make lifestyle adjustment, because prevention is still where we need to be. And so we need to move this knowledge away from academia into the public community, where people need to know a bit more about cancer to enable them make lifestyle changes in order to minimize the risk of having this disease.